Kempner diet is a diet of rice. They use white rice and fruit and fruit juice and sugar, table sugar. They had to give table sugar to cut the nutrient content of the rice. You see, rice has so much protein in it that it would burden failing kidneys and failing livers. So in some cases, Kempner had to make half the diet sugar, which has no protein, so that the patient would do okay, would not suffer from too much protein. A white rice was just about 5% protein. His naysayers, the people who wanted to see Kempner fail, actually took 8 of his patients who were on the rice diet, put them in a metabolic ward, and studied them, and reported they could find no metabolic deficiencies and only positive results on his patients. If you want to find this research easily, just by going to a link, you go to my December 2013 newsletter, and just what I said about his contemporaries trying to prove him wrong, just hit the link and you'll read the paper. Yeah. Anyway, that's the kind of diet that he fed him. Why did he use white rice? Because he thought it was more palatable and it was more convenient to get. You can read about Walter Kempner. One of his close associates for many years wrote a biography of him. It's well worth getting if you're interested in this subject. It talks about the man and about the things that he did. So the McDougall diet versus the rice diet, the Kempner diet. Well, one thing he did, he showed me, when I read his work, the power of diet therapy, and he also showed me that there's no possibility of developing any nutritional deficiencies based on the diet I recommended. After all, he recommended rice and sugar and fruit, and they couldn't prove any nutritional deficiencies. So all this nonsense about where do you get your protein, and where do you get your calcium, all the things that people would worry about, even myself when I first started out, were proved to be nonsense by his work. Before I was born, in 1947, Kempner had disproven concepts that your doctors hold today to be true. Diet has little to do with heart disease. Many, if not most of your doctors still believe that, and Kempner proved that to be wrong before I was born. Additional protein improves health. I know almost all your doctors still believe that. Kempner proved that to be incorrect before I was born. And carbohydrates cause diabetes. He showed that his diet, which was 93% carbohydrate, cured type 2 diabetes 100% of the time. All this published before 1953. Well, I do use the Kempner diet sometimes. I still take care of real patients. I'm still a doctor. I take care of patients. And we usually have 40 to 50 people each program. And we run 6 programs for the public a year and 2 for businesses a year, our programs. And about 3 times a year, I have a patient who is so severely ill, primarily with kidney disease. They only have maybe 10, 15, 20% of their kidney function left, that I have to teach them the rice diet. I consider the rice diet the diet for the nearly dead, and that's how I use it. But the McDougall diet, what I teach, what Jeff and Sabrina Nelson have brought you together to learn, what Caldwell Esselstyn and Ann are trying to teach you. This is the diet for the living. There's no apology necessary. This is the best tasting diet, the least inexpensive diet, the diet that is most kind to animals and to the planet. There's just no reason to, in any way, question what you're doing once you know the truth.